Welcome back to This is VANCOLOUR. Last week marked the grim 10-year anniversary since British Columbia declared a toxic drug emergency. In that time, over 18,000 British Columbians have died from toxic drugs. So in a province where 200,000 people use unregulated drugs, are we really treating the crisis like the emergency that we say it is? Here to discuss, a motivational speaker and advocate for harm reduction and recovery with lived experience. He was recently featured in the documentary Resurrection, Guy Felicella. Guy, always a pleasure. Thanks so much for being here tonight.
Thanks for having me.
So we're entering the 11th year since the government of British Columbia declared this crisis an emergency. I feel like we all know someone who has died because of this. You're on the front line, so obviously you know many people and you've saved many people. You know, thinking about this grim anniversary, how do you process that?
I don't know if you do. You know, it's so tragic to, see the amount of lives lost. And, grief is something that comes in waves, and there's so much grief that, I'm just concerned that when I start to look at things, it becomes too overwhelming. So I just try to, distract myself, do things to, for my mental health so I can keep functioning in it.
Yeah. And like I said, you are on the front line. So when we think about the government's response to the toxic drug crisis, which they say it's an emergency, what did they get right? What did they do that actually did have an impact?
Well, definitely the rollout of naloxone in the province. We're seeing still an astronomical amount of overdose events, but we're seeing less deaths as the deaths went
down. And
naloxone
is what reverses those overdoses.
Correct. Yeah. So that part has been like, you can get naloxone everywhere. So widespread naloxone, road to recovery at St. Paul's, quicker access to detox and treatment services. And they have, implemented some harm reduction services as well across the province. But in the rural and remote areas, especially, they could do a better job.
Yeah. So let's talk about that then. In terms of where you feel the government response has fallen short. I mean, we still live in a province where 5 people a day die because of toxic drugs. Again, it's gone on for 10 years, on the 11th year now. What are they getting wrong?
Well, here's the thing. I mean, it's easy to criticize the government, but one thing for sure, it's not just a policy issue, it's also a societal issue.
Okay.
And so, us as the people, the government doesn't exist in a vacuum. They're a reflection of us. And so, we already know what causes risky substance use behaviors. It's like trauma, unaddressed societal issues, pain, isolation. And so as a society, we haven't demanded that people have dignified housing, dignified access to treatment instead of punishment. And so, that is the government's responsibility to address those issues, not the public's, but it's also, we could do a better job at pushing the government to address those issues.
Yeah. I just feel like in some perhaps policies like decriminalization, where there was an intent to shift things to the healthcare system as opposed to the criminal justice system, they roll out a policy and then the follow through that is needed is just not there. Do you get that sense on the ground as well, where the government announces something, but the supports needed to actually make it successful never got off the ground?
Yeah, I think, today we have a lot more supports in place than when decriminalization was implemented, which would have been a great avenue. You just can't announce one policy and not back it up with, having the access and support services available for people to access. So essentially, scaling back the harm reduction services. One of the things too, as well, is that they scaled back really a safer supply program. When that's not causing the deaths, the illicit drug supply is causing the deaths. And really everything that we do from a public health approach is try to reduce the harms caused by organized crime, what they're dumping in our society, except people go after the health services that we're providing instead of the main culprit.
Yeah. And so you just mentioned that. I mean, we have a government that's rolling back a lot of their safe supply initiatives. We have a government that rolled back decriminalization when, again, they said it's a health issue, not a criminal justice issue. What is government not understanding that you would hope that they get to really, move forward and save lives here?
Well, first off, you're not going to solve the crisis by criminalizing people. And you're not going to solve the crisis just by, having a medical approach to the to the crisis either. You have to really look at, the 4 pillars, which was, harm reduction, treatment, prevention, recovery, except we've gone more in on the enforcement side of things instead of the support side of things. And so it's just going to keep continuing to go the way it's going to go until we actually look at going to do a real robust health authority approach or health services approach. What we've done is we've really tinkered on the outliners of this because it's such a criminalized issue. So we've only been able to do little components of it instead of actually doing what a full-on scale health approach would have looked like.
Yeah. Do you think government failed to communicate to the public things like harm reduction? Because I feel like there have been a lot of actors that have taken over these terms. And for a lot of people in the public, they go, oh, harm reduction's a bad thing. It's actually causing the deaths.
Yeah, I think, well, definitely the government can communicate what they're doing in a way that's more understanding to the public. I think also, too, the failure is there's a lot of misinformation on what harm reduction is as well in our society. And that's honestly caused a lot of division as well. And so,
What is harm reduction? Explain to someone who may not be familiar with the term.
Well, harm reduction just really reduces the harms caused by, the illicit drug supply. It can be supervised consumption sites, can be access to healthcare services, access to mental health, addiction services. All of that falls on the guide of harm reduction. It's essentially like, wearing a bike helmet. If you fall and you hit your head on the bike helmet, that would reduce the harm. If you didn't have it, will it stop crashes from happening? No. Crashes are still going to happen, but it reduces the harm. Similar to what harm reduction services is it really reduces the harms that's unfortunately...
It's like Nicorette gum for smokers.
Yes, yeah. Exactly.
Yeah, and I think people kind of forget that it's, clean needles will help stop the spread of disease. Or, when it comes to supervised consumption, if there's an overdose, it can be reacted on very quickly, right?
Yeah, well, totally. And I mean, here's the thing too, is that, if you can, oxygen to the brain when somebody overdoses is vital. And at a supervised consumption site, you can immediately respond. Somebody overdoses on the street, you just, the longer that there no oxygen to the brain is, the longer the brain injury. And then all of a sudden they're in care homes. And, that if even if you didn't care about people using substances, that would cost taxpayers an astronomical amount of money because we're paying for their care now.
Yeah, exactly.
Yeah.
Guy, you're doing good work on the front line. Thank you so much for your time tonight.
Yeah, thanks for having me, Mo.
Folks, that was one of the most powerful voices in our province's toxic drug crisis, Guy Felicella. Now, after some business, in the age of AI, do you even own your own face? Kyla Lee will explain the laws around the dystopian world we live in up next.